Okay, so good morning. Thank you all for coming along and attending. It's great to see that we've already got quite a few online joining us. As I noted just on the next slide there, we are recording this meeting, and that's just because we want to make sure that it is available to all RACF staff in our region who aren't able to attend today, and also to make it available to you guys online afterwards if you want to share it with other staff internally. So I'll officially open the meeting by acknowledging the traditional custodians. So Country to Coast Queensland would like to acknowledge and pay respect to the traditional custodians of the land on which we work and live. We recognise their continuing connection to land, waters, and community and honour their cultures, and we extend this respect to elders past, present, and emerging. We're going to start with a bit of an overview of what we hope you're going to get from today's session. So there's 5 key learning outcomes that are on the slide there. And essentially, following the webinar, participants should be able to use and modify where needed the resources that we've developed in our telehealth toolkit to support effective use of telehealth. The facilities who receive the telehealth grant funding from CCQ, which is the majority in our region, you'll be able to plan for and collect the data that you need for the impact statement reporting to be able to show the impact of that increased access to and use of telehealth within your facility. We also have Jude and Jody from Health Direct here to support you to understand how to utilise their video call platform for appointments. And this is the primary platform that's used by GPs in our region, so it is a really important one to be across. And we're lucky to also have our 3 Central Queensland Wide Bay and Sunshine Coast HHSs here to support you to understand or revisit for those who already have used it before, how to support Queensland Health telehealth appointments for your residents. And then finally, we hope to be able to provide any clarity for questions you might have around the toolkit, the impact statement reporting, and use of the platforms through our Q&A session, which will be at the end. You'll also have access to the contact details for all of our speakers that are on the screen there. So if there are any queries that you might have following the webinar, you'll have a list of contacts to go to. So introducing those that we have online speaking and supporting today's webinar. So my name's Paige Martinez and I'm the Senior Manager for Palliative and End of Life Care with Country to Coast Queensland. From our organisation, we've also got Georgia Rummery online. Georgia's our Project Officer for Healthy Living. She's managing the slide deck and the chat today for us. We've got Anne Bartushat, who's our Healthy Aging Coordinator in Central Queensland. And we are recruiting 2 Healthy Aging Coordinators for Wide Bay and Sunshine Coast regions as well. We have Jude Cobb and Jody Earle, who are from Health Direct and are coming to share all their knowledge of that platform with us. We have Chrissy McAnally, who's the Telehealth Coordinator CNC for Central Queensland Hospital and Health Service. We've got Kathy Tobin, the CNC, and Megan Cooper, the Telehealth Coordinator from Wide Bay HHS. And we have Janet Langlois, who's the NUM and Coordinator for Telehealth at the Sunshine Coast HHS. So we've got quite a lineup of speakers today. Just on meeting etiquette. So as I said, George is going to be managing the chat function throughout the webinar. We'll be weaving in your questions from the chat box at appropriate times. And alternatively, you can use that raise hand icon and you can ask your question directly, just making sure that you're not on mute. There will also be a Q&A session at the end with all of our speakers. So if your questions aren't answered prior, they will be answered in that. And just we also ask that if you're not talking, please remain muted so that we can minimize any background noise. Okay, so within our toolkit, which I'm going to talk through briefly, we've created a suite of resources to support residential aged care facilities to implement telehealth, and they were co-designed with with a subject matter expert group. Yes, they've been thoroughly worked up by key contacts. Um, we developed this resource toolkit to assist our RACFs to commence conducting or support the continuation of, for those that were already doing it, telehealth consults with their residents. As we all know, telehealth consults allow residential aged care facility residents to have timely access to GPs and other wider healthcare professionals, the HHS, etc., rather than always having to travel or wait for those in-person visits from their visiting clinicians. So really just wanted to note here that the resources that we've got in our toolkit are purposefully broad. They are for facilities to adapt for their specific needs during the implementation and that longer term maintenance of telehealth services. We've got a lot of templates threaded throughout the toolkit, and they include a reasonable amount of detail to be tailored by facilities. So essentially, the toolkit's a practical resource for you as facility staff online today to be able to refer to and use and modify as your facility sees appropriate and in line with your existing policies that you have and processes that you have in place, and just kind of helps to give you a better understanding of implementing telehealth services. The resources within the toolkit, you'll see, I'll go through them in a moment, have a cover page with the name of the resource. They provide a bit of a description around their purpose, and we provide links out to further best practice information as well. So, I guess just to summarize that kind of disclaimer, the information within the toolkit is very much for facilities to access, consider when they're adapting and developing their own resources that align with their wider ways of working. Okay, so today we're going to introduce a case study for the webinar, and just wanted to note that this case is just one example of where telehealth can be used. So, as it notes there, there's a lot of different times when it's appropriate to use telehealth, and this needs to be determined case by case by both the facility and the distant end clinician for that clinical appropriateness. So an example of how our toolkit supports this is on the slide just there. So you can see our THO2 procedure is around resident selection and clinical appropriateness for a telehealth consult. And that procedure takes into account clinical judgment, prioritization, patient needs, and the needs of the individual appointment. So, kind of lays a bit of a framework for what the facility can consider when developing their own procedures around telehealth if they're not already in place. Okay, so this is what our toolkit looks like. We've shared this quite a few times before now, so you may have seen it already. It went out in the invitation to this webinar. It went out via our email correspondence with our grant recipients. It's gone out via our Aged Care Matters newsletters, and Anne has been sharing it as well in our local virtual RACF forums. So the toolkit itself is a 39-page document, and I know a lot of you have had a chance to look through it because
Hello.
we have been getting some questions come through
All
via
right. Did you
email
find it? All right. I'll send her an email.
around various templates, and we've been
Oh,
able
you
to
will?
respond to those.
Okay. All right.
Can I just ask that if you are not talking, if you are able to go on mute, please? Thank you. So as you can see there, that's the table of contents of our toolkit. And the first section there provides a bit of a guide to creating those policy and procedures. So that includes that THO2 that we saw on the previous slide. The toolkit then goes into the resident-facing resources and checklists for staff supporting resident consults on the RACF end. There's technical support guides in there also. And then the final section, as you can see at the bottom of the toolkit, is really around monitoring and evaluation. So that includes tracking the feedback from residents and staff, logging consultations, and considering what quality improvements can be done. So this section is used to support that quality improvement as well as reporting for facilities that are participating in our CCQ grant process. We will explore this in a bit more detail towards the end of the webinar. Georgia is going to just share a link to the toolkit in the chat. So we'll reference and point to this resource throughout the webinar via some little navy blue boxes you'll see throughout the slides. So you're welcome to open that toolkit now if you have another screen that you want to have it open and you can follow along. Okay, so introducing our case study, which we're going to carry through the rest of this presentation. So our resident Daphne Smith is an 89-year-old resident of the Sunshine Boulevard Aged Care Facility. She's lived in the facility for 3 years and her health conditions include type 2 diabetes, hypertension and osteoarthritis. So Daphne, like you'd see in many aged care residents, requires regular medical checkups, medication management, and consultation with her specialists. Recently, Mrs. Smith was briefly hospitalised for cellulitis of her lower limb. After her successful initial treatment in the hospital setting, Mrs. Smith has been discharged from the hospital back to Sunshine Boulevard Aged Care Facility, and she's going to require a follow up appointment with her regular GP, as well as a further check in with the hospital outpatient clinic. Mrs. Smith's family have seen Sunshine Boulevard Aged Care promoting telehealth via a telehealth brochure and flyer. And they and Mrs. Smith both agree that if telehealth appointments could be organised for follow up where appropriate, that would be beneficial for Mrs. Smith and her care. So they asked the nursing staff at the RACF if this would be possible to action. On the facilities end, it is possible to arrange these appointments via telehealth because Sunshine Boulevard Aged Care Facility was a recipient of CCQ's telehealth grant funding, meaning that they were able to purchase the appropriate telehealth equipment in consultation with their internal IT manager. So it works well for them and it's able to be maintained alongside their wider digital systems and technology. The facility have also set up their own policies and procedures that align with their organisation requirements, and they used CCQ's toolkit resources to support this. So they found this, as you can see on the slide, from page 5 onwards of the telehealth toolkit and used that as a guide. As a part of that procedure that the procedures that the facility had set up, they've utilised the flyers and brochures that are available within the toolkit. So they've printed them out and had them available to families and residents throughout the facility. And these are the resources that were cited by Mrs. Smith's family and Mrs. Smith herself, and gave them the information that they needed and actually prompted them to query having Mrs. Smith's upcoming appointments via telehealth. So these resources are able to provide family and residents information on how telehealth works, what they can expect in the consult itself, privacy considerations, and more. Georgia is going to share a link to the flyer and brochure in the chat as well. So they are embedded into the toolkit itself in those versions that you see on the screen, but they're also available separately for ease of access and printing by facilities. So within their setup for telehealth, Sunshine Boulevard facility also has a process in place for scheduling telehealth appointments so that they can ensure all participants are aware of the mode of the appointment and that the appointment is flagged and scheduled in their system so that it isn't missed and there's a staff member available to support. So the facility knows that the processes can look different on the distant end of the consult depending who their resident's appointment is with. So if they're with a GP, with the HHS, they might be using different software and slightly different processes. So they work in line with this as well. So Daphne's upcoming, or Daphne Mrs. Smith, her upcoming appointment is with her GP, who commonly uses the Health Direct system, as many GPs in our region do. And the facility are set up to use Health Direct. They're really comfortable guiding her through the appointment. And I'm now going to pass over to Health Direct, who will share what this setup and the appointment looks like on the facility's end.
Thank you. Can you hear me okay?
Yep.
Yep. Okay, thank you. Yes, so my name's Jude. Jodie is here as well from the Health Direct video call service. I'm just going to speak quite briefly about our service, just to give a bit of an overview. So it is a free government funded video telehealth service that you have access to in aged care homes to have your own clinic, and I'll talk about that in a moment. So we're not going to go through a specific demo of our telehealth service. There's a lot of content in the webinar today, and we didn't want to, add a large demonstration or anything like that. So I'm just going to give an overview, and we're going to play a short video shortly just regarding the workflows for residential aged care, which will just give you an idea about what is possible. And then you'll have our contact details. So if you do want anything else following this presentation, you can get in touch with us and we can do demonstrations and training and whatever you need. So as I said, free government funded video telehealth service. You can see on the screen there, that's an example of a clinic in our service which aged care homes have access to under government funding. So you'd be able to have your own what is called a clinic, and then people can arrive in that clinic and you can join them and you can do a telehealth consultation with the resident, with one of the staff members, and whoever they have a consultation with. So you can have your own free virtual account for your aged care home. You're in charge of who you send the link out to. So for example, GPs. So today we're talking about Daphne who needs to see her GP. You could send your clinic link out to the GP. They click on that and arrive in this waiting area. You'll see them there and you click on join to join them. Once you've got Daphne set up in the space where you're going to do that telehealth consultation. You can also use it for anything you like to do with the health consultations for your residents. So, for example, case conferences, aged care assessments. You can add other people into a call, as you'll see in a minute in the video. So you could add family members who may be in, another location and unable to attend in person if they need to be there. So that's an overview, a really quick overview of the service. So what we're going to do now is play a video, and it doesn't show the platform itself, but it shows what is possible in workflow terms for aged care, and it'll give you a real sense of what you're able to do. Okay, thanks. So that gives you it's a very quick video, but gives you an idea of exactly what you can do with video call. As I said, we can provide support. You can contact us and we can take you through the platform. We can talk about workflows or we can tailor that to suit your needs. So video call support is available. We can do onboarding support. We can create the clinics, or your PHN can as well, depending on our agreements there. Clinic configuration, so setting it up so it suits your aged care home. It's a very flexible platform, so we can assist with that. Assistance with designing workflows. You saw an overarching workflow there. You might do something a little bit different in your aged care home, and we can work that in with the flexibility as well. And we've got tailored resources and starter packs. You can see that little picture there is from our resource centre. We've got a very comprehensive resource centre with all the information you'll need. And that is from our aged care portal. So there's a specific aged care portal that we've created. And these are the little sections in there that you can see on the screen. We do free training, tailored to suit your needs. And we've got the resource centre aged care portal, as I said. So we can do training for individuals and groups of RACHs as well at all user levels. So it might be someone who's coordinating the telehealth, or it might be a staff member that's assisting with the resident in their appointment. And we can assist with ongoing admin and technical support via video support channels, and you'll be given our contact details there. So I think for now, that's probably what we're going to go through, and that you can use, as I said, you can use that for anything that we're talking about in the case study here for telehealth appointments. So you can let us know if you've got any questions. Otherwise, you can get in touch with us separately. Thank you.
Beautiful. So, following Mrs. Smith's appointment with her GP using the telehealth platform, she then has her follow-up appointment with the HHS following her recent brief hospital visit. So, over to our hospital and health service colleagues, Janet.
Hello, thank you. Thanks, Paige. And it's kind of exciting to be involved because I think we all think that telehealth or video calling is, the ants pants, and I think it's great. So, so services seeking appointments with residents of RACF may send a letter. They may phone the RACF staff or may send an email with appointment details. Now, while this process might differ between HHSs, one thing we do have in common is that we all prefer and recommend the use of the telehealth portal for the HHS Queensland Health appointments. So in the case of Mrs. Smith, because she was being discharged home, this appointment probably would have been booked and you would get a letter offering you possibly a face-to-face appointment. So then you determine that this would be probably better for a telehealth appointment to suit everybody. So then what you can do then is contact the service that was providing the appointment. Now on a letter, for example, there will be a contact phone number, but I'd also suggest at this point that you reach out to your local telehealth unit at each HHS, and we can advocate for the change of modality, given that it's we always have to be cautious because sometimes it's not appropriate and the clinician here may say no, but I wouldn't be put off by that because, there's always ways and means, and we do try to encourage it as much as possible. Basically, the HHS will send you a dial-in code to access our portal, and it's just that it's a web-based product, I guess, and you can add that as a favourite to your web browser. But I think Megan has got some slides that she's going to talk through as well.
Thanks, Janet. Hi, everyone. I'm Megan Cooper from Wide Bay. I'm the coordinator here. So very similar to the Health Direct platform, Queensland Health has designed our own encrypted platform that is used across all of Queensland Health facilities. So there's kind of two key ways that you can get in. The web browser that Janet was talking about, which is quite simple. It's a web address, 6-digit dial-in number, enter the patient's name as we've asked or sent the letter out to that patient so we can easily identify them. And what we see is very similar to what Health Direct have, that kind of clinic establishment. The other way that we can connect you through to the portal is through a rapid invite, which you can see on the screen here. So it either comes through an email or a text message. Now, I know most of you probably aren't using phones in your facility, so that might not apply. But if we were, say, directing the link to the patient or the patient's family, you would get a message from Queensland Health. Click on that link, ask you to enable your microphone and camera so that we can see and hear you, and it will take you straight into the virtual clinic platform. So what you're seeing there is what the invitation would look like from the virtual clinic. And if we flip across to the next slide, please, Georgia, thank you. This is the telehealth portal from a web address. So it doesn't really matter what browser you're using. If you type in the web address or click on the link that you've been given, you can do it either way. And the same applies. Enter the dial-in number and the patient's name, click connect. The most important thing to note here is that you hang up out of the consultation, and that if you've used this platform before, it can sometimes pre-populate the previous patient's name. So you can just clear your history and click on that link and go back in through again. But the principles, as Jude described, of Health Direct are very much the same here, but it's just that in our case, we have control of the clinic environment, and you guys are the invited participants. Thank you. Sorry,
I think this one's me, Chrissy McAnally, Telehealth Coordinator from Central Queensland. So if we have our RACF staff dialing in to support Daphne during a consult, so it's very helpful to have a staff member, whoever that is, whether it's nurse or a carer or even the family member, you know, with the resident at the RACF to assist with the video conferencing, making sure that we have a sound check. The telehealth portal that we use for Queensland Health actually has a test dial number, so that's great, so people can test dial their devices. Lighting is really important to make sure you're not in a dark room with like natural light coming from behind. It's very hard to see the patient or to focus on a wound or something like that you might be looking at. Within the settings, you can check the microphone and camera and change between a microphone or a camera that you might have on the laptop, or you might have, you know, on another device that you're using, or you've had the headphones plugged in, you've taken them out, and then all of a sudden you can't hear. So that's really good to go into the settings and support and make sure that you can hear and see and be heard. Yep, there's a test code that we can send out for everyone to check that their system can be used for the telehealth portal, which most systems can be. And the HHS clinician will usually, as in say it's a surgical clinic or a medical clinic, they will usually ask for anything else that they might require from the patient, whether that's observations or previous information, or how did they go in their allied health visit that they had recently, that sort of stuff. And it's great to not have too much background noise in your call, just to make sure, you know, the clinician can hear well. Yeah, and that's probably about it.
Beautiful. Thank you, Chrissy. And just noting that, linking that back to the toolkit as well, from page 22 of the toolkit, there is a telehealth consultation checklist, which kind of can support your facility staff to be able to go through all of those things that Chrissy's just mentioned, and you know, just provide a structured way if you would like to implement that in a bit of a checklist to make sure that's all happening. All right, we're going to lead into a discussion around the impact statement reporting and an example of how we would capture that data for our case study today.
Thank you, Paige. My name is Anne Bartelschott. I'm the Healthy Aging Coordinator here in CQ, and I'm going to talk you through the data collection part of the impact statement. So for those of you who have participated in the CCQ Telehealth Grant Program, you might be already familiar with the Telehealth impact statement. So the impact statement was included in the Telehealth Grant information pack and is a mandatory requirement as part of the grant process. In this part of the presentation, I will predominantly focus on the data collection section of the impact statement and providing some examples and guidance on how to complete it. Next slide, please. So on page 2 of the impact statement, Sunshine Boulevard has entered the funding amount they received from CCQ, which is here $8,770. They have also indicated the implementation of a Model A for the mobile telehealth setup. Check the boxes for the telehealth equipment they purchased, in this case, laptop trolley, Wi-Fi extender, examination camera, and portable ECG heart monitor. And they also ticked and confirmed that they used the Telehealth toolkit to support their implementation. The next section of the impact statement covers reporting on consultations. So the consultation register report template can be used to record all consultation in a specific time period. Sunshine Boulevard Aged Care has summarized all October consultation in the consultation register report and has also entered it into the section 5.1.2 number of consultations on page 3 of the impact statement. The consultation log within the toolkit serves as a template for facility to capture data as consultations occur, which can then inform the completion of the consultation register report and also help with monitoring equipment. The aged care nurses at Sunshine Boulevard recorded 3 telehealth consultations for Daphne Smith in October, one for a GP, one for allied health, and one for a specialist outpatient's appointment. On page 4, the impact statement requires facilities to provide a summary of their resident satisfaction with the telehealth consultation. Sunshine Boulevard has used a summary of feedback, residents' feedback for scoring from page 44 of the toolkit and simply copy and pasted it into the impact statement. Just a note here, we will only ask facilities to provide aggregated, summarized feedback as well. The resident feedback question template can be used to gather feedback from your residents, which can inform future quality improvement activities. All residents' feedback can be summarized into the resident scoring summary report for reporting purposes in the impact statement. You can see here, Daphne was offered the opportunity to provide feedback following one of her consultation. And as you can see from the feedback she provided, the smiley face indicates that she liked the flyer and brochure and thought that that was really helpful. However, the neutral smiley face indicates that she wasn't very happy about the nurse doing the talking. And this could be an example of a quality improvement opportunity. Next slide. Also on page 4, the impact statement requires facilities to provide a summary of their staff's satisfaction and confidence with telehealth. Sunshine Boulevard has used a summary of staff feedback for scoring from page 46 of the toolkit and simply copy and pasted it into the impact statement. The staff feedback question template can be used to gather feedback from your staff, which can also inform future quality improvement activities. And all staff feedback can be aggregated, summarized into the staff scoring summary report for reporting purposes. In this case, Nurse Mary completed a feedback form following Daphne Smith's GP telehealth consultation. And as you can see from the feedback she provided, she doesn't feel very confident in supporting the residents during the consultation. Again, this is an example of a quality improvement opportunity. On page 5, the impact statement requires facilities to provide additional outcomes. Sunshine Boulevard Aged Care have chosen to focus on reducing hospital admissions and emergency department visits. They have provided data comparing telehealth consultation, residents transferred to ED, and residents admitted to hospital before and after the telehealth implementation. And as you can see, the equipment was only implemented in October, and that makes it very challenging to establish any clear links this early in the recording of numbers. Over to you, Paige.
Sorry, I was double muted there. Thank you so much. So that that's our formal presentations that we have for today. On the slide here now, we've got the contact details for each of our HHSs, so you can get in contact around anything telehealth with your local HHS should you need. We've also got the video call support email address and phone number there for Health Direct. So if there are any further questions outside of this session around using Health Direct platform, you can get in contact there. And on our end with Country to Coast Queensland, we've got our Older Persons Health email, which a lot of facilities would already be familiar with. So if you get in touch via that email address, we're able to redirect your query to your local healthy ageing coordinator. So we have Anne in CQ and are currently recruiting for Wide Bay and Sunshine Coast. And we are able to provide more support if needed around the impact statement reporting. Obviously, there's only so much you can talk through in a webinar, but very happy to support a little bit more one-on-one where needed as well. Okay, so we're going to open up our webinar session now to questions that we might have. I'll just throw to Georgia first and just ask if any questions have come through the chat.
No.
Nope. Beautiful. Okay, well, we'll just give a few moments if anybody would like to type anything into the chat box, or alternatively, if you'd like to pop your hand up and ask a question directly. Okay, so Chrissy has asked a question around the pack. Are you referring to the toolkit, Chrissy?
Yeah, I was just meaning the toolkit, like you're saying it was going to be available. Is that from like your site that people can get to that for information, or?
Yeah, so throughout the webinar, George has been popping the links into the chat there. So if you scroll up to that top chat, that's the toolkit link there, and then we've got the links to the Q&A brochure and telehealth flyer. And George has just put some more information there.
And if someone doesn't have that link and they just go to your site, can they find it just on your webpage?
Yes, yep, it's available on our webpage as well. So George has just popped in there that if you go to the Residential Aged Care Support webpage, and then you go to the drop-down Telehealth and Enhanced After Hours Support for Residential Aged Care Facilities, that's how you navigate to that. And it has the links to all of those, to the toolkit and the flyer and brochure there as well. And of course, if you're having any difficulty accessing it or navigating to it, let us know and we can help you out.
Question from Michelle. When is this going to start in each facility?
Yep, so the grant process has wrapped up and finalised, and facilities who took part in the grant process received their funding just after the end of financial year, so around end of July, early August. That funding went through, and facilities are obviously on slightly different time frames as far as ordering equipment and getting it in. We did build into the grant process, many of you would be familiar, that facilities are able to purchase equipment that is in line with their facilities needs. We didn't want to prescribe the type of equipment that was needed because we wanted to make sure it was able to be maintained by individual facilities' IT departments. So yeah, we're all at slightly different stages. If there's any facilities online that want to comment on where they're at, we've heard from a few via email that the equipment's on order. What I will note is that our impact statement during the application for the grant process, it was noted that that will be due in February 2024. We will do a check-in with facilities after the Christmas period when we come back in January and just check whether equipment is on site. If equipment has had further delays in coming on site, we might look to push back that impact statement reporting because if we haven't had the equipment for a decent amount of time, then we obviously haven't been able to track anything. But are there any facilities online who'd like to comment on where they're at with securing their equipment or starting their telehealth consults?
Hi, it's Wendy from Gracehaven in Bundaberg.
Hi, Wendy.
We've received all of ours probably 2 weeks ago, so we are almost ready to go. IT have had it for a little while just to do their bits and pieces. So yeah, we're all pretty much ready to go.
Beautiful. So good to hear, Wendy.
Hi, it's Fran at Leinster Place and Rocky. We've got majority of our equipment too. We're just waiting on a couple of extra bits and pieces to come in, and then we'll be right to set up as well.
Great. It's all starting to flow in. And yeah, let us know if you need any support as you're getting it all set up. Karen from Southern Cross has popped in the chat in Caloundra that they're still waiting on their setup. So they're hoping in the next few weeks. And Catherine Horn from Noosa Care just before that had noted that they haven't received their equipment quite yet. Yeah, and Chrissy's just highlighting that there is a consent template within the toolkit if facilities do wish to use that on their own end. Obviously, as we discussed, everything in line with their own policies, procedures and processes. But Chrissy just wanted to highlight that that's not required for Queensland Health RACF appointments. It's consent is not a requirement on their end. Any questions through the chat that I've missed, Georgia? No. Beautiful. Okay, well, I will remain online for the next 5 minutes or so just to see if anybody has any last minute thoughts or questions that they want to ask. But otherwise, we really just wanted to thank you all for making the time to be here today. We know you're all in very, very busy roles, and would also like to thank Wide Bay HHS, CQ HHS, Sunshine Coast HHS, and Health Direct for making the time to collaborate with us and providing this valuable information to our local residential aged care facilities. So we look forward to continuing to work with you all and hearing from you soon. Thank you.